All right. So let's go ahead, let's mute yourselves. And then if you have questions, you can come back in and ask always, right? You can always use the chat box as well. And if I don't see your chat, then just unmute yourself and ask the question. Okay, so we'll do part 2. This is going to be quicker. And then what I'll do is I'll put a quizzes on by 5 o'clock tonight. That's going to include the stuff from Wednesday and then also from today. Okay, so here we go. So just as a reminder, because we talked about the anatomy of the body and the nervous system, right? And when we're looking at the nervous system and we're talking about the peripheral nervous system, does anybody remember what makes up the central nervous system?
The brain and the spinal cord.
Exactly. So the peripheral nervous system is all those nerves that run off of the central nervous system, right? And they're sending messages back and forth and they're using neurons to do that. So inside the peripheral nervous system, right, we've got the autonomic nervous system. So it's like a subcategory. And inside of that, then we have 2 subcategories. So we have the sympathetic and the parasympathetic division, okay? Now, just as a reminder, right, these are all different body parts. And then here's what's happening depending on the situation. So in this one, in the sympathetic, we have arousing effects, meaning the body is waking up and we have movement, right? Remember we talked about arousal. Sometimes people, when they think of that, they think only of sexual arousal, and that's not the case. When we're talking about arousal, we're talking about like a waking of the body to start to do things, okay? So in your eyes, your pupils are dilating. Oh, Sam, I think people are having trouble with Google Classroom today. Hit refresh on Google Classroom and see if that helps. If not, yeah.
Sam, go on Google Classroom, press the classwork tab, go to note sheets, and it's the first one. It pops up that way, even if it doesn't pop up on our stream. If you go through the classwork tab, then you go to the note sheets, it's the first one. But it doesn't pop up as like on our regular, like everyday stream.
You know what it does? It's just the third one down. I forgot because I moved up the schedule in the video. So it's the third one down on the stream. Thank you, Alina. That was very helpful. That helped remind me where I put it. Okay. So we've got your eyes, we've got your pupils dilating, you've got salivation decreasing, your skin is starting to perspire, respiration is increasing, your heart rate's accelerating. We're inhibiting digestion, meaning your body's not trying to digest food in this state. You're secreting stress hormones, okay? So for instance, like adrenaline. And you have reduced immune system function, okay? On the other side, the parasympathetic division, we've got the opposite. This is when the body starts to calm down and really kind of step those that arousal down from what you had on the other side. So instead of your pupils dilating, we're now contracting. Your salivation increases, your skin dries up. It's not that it gets dry, but you're not sweating like you were in the sympathetic division. Respiration decreases, meaning you're breathing more calmly, more regularly, not as deeply. Okay, your heart rate slows, digestion starts. Your body's like, hey, I'm in a calm phase. I can go ahead and digest this food that's inside. Your adrenal glands are going to decrease the level of stress hormone that it's feeling. So it's going to lower that level of maybe cortisol or maybe adrenaline, right? And then your immune system functioning is going to be enhanced because it's not your body's not working overtime. So the immune system can really kind of kick in. So these are important things to remember biologically of what's happening in your body, because certain emotions are going to cause different divisions to start. Can anybody think of an emotion that would get the sympathetic division started?
Fear.
Yes, absolutely. Fear. What might be another emotion that would get your pupils to dilate, your heart rate up? You might start sweating.
Love.
When you're in love,
Yeah, love, absolutely. Love it, especially in the sense of sexual attraction kind of love, right? What other emotion might come out of or might have the sympathetic division going? We've got fear, we've got like sexual attraction kind of love.
What about like anxiety?
Yeah, anxiety, anger, exactly. On the other side of it, for the parasympathetic division, what might be some emotions on that side?
Just like relaxed and calm.
What are the emotions though?
Neutral.
Okay, neutral emotion, absolutely. We saw that in the faces.
Boredom?
Yeah, not necessarily an emotion. Think back to some of the emotions that were on like Plutchik's wheel. How about not sexual attraction kind of love, but what kind of love could it be?
Feeling accepted.
Yeah, feeling accepted, feeling loved by those around you in a non-sexual way, right? Joy, okay? Not to the sense of excitement joy, but just feeling joy or gratitude, okay? So just keep in mind that your body is a big part of this, right? We've got that nature piece to it where these things are happening in your body. And this is going to make a difference when we talk about like three main theories of emotion. All right. So here's the first theory of emotion, the James Lang theory. All right. It says that environmental stimuli, so things happening in the world around you, can cause a physiological change, can cause those changes. So those things we just talked about, it can cause your body to react either using the sympathetic or the parasympathetic division, okay? And from those changes, emotions will arise because we are aware of those changes, okay? So here's what it's saying. Let's say the stimulus is a huge, big, snarling dog barking and growling at you. Okay? There's a factor there that then causes a physiological reaction. So if you see a big, scary dog barking at you and coming towards you, what might be some physiological reactions that you might have?
Run.
Inside your own body, what could happen?
Like the stuff that happens in the sympathetic division, so people's dilating, salivation decreasing, skin.
Exactly. So yeah, if we look back here, right, we're looking at the sympathetic division. Like if I see a big scary dog running at me, snarling, barking, looking like it's going to bite me, right? We start to get pupils dilating. I start sweating. My heart rate is going to increase. My respiration, I'm going to start breathing heavier. I'm going to release stress hormones. Okay. So they're saying in this theory that you have something that causes your body to react. That's the physiological reaction. Once your body starts to react, then that signals your brain to say, wait a minute, what is this that's happening in the body? It identifies that there are changes in the body. And depending on what those changes are, it results in your body recognizing an emotion. Then you're able to express emotion. So it's saying it has to happen in this theory. They're saying it has to happen in that order. Okay. There has to be an environmental factor that leads to a physiological reaction inside your body. Then your brain recognizes that changes are happening and then an emotion happens. Okay. So like fear might be the one on that one. Okay. Now the next one, the Cannon-Bard theory. Okay. Physiological changes and emotions happen simultaneously. What does that word simultaneously mean?
At the same time.
At the same time.
That's exactly it. So simultaneously is at the same time. So they're saying, no, it's not linear. It's not this, then this, then this, then this. It's the stimulus is this big, nasty dog running towards me. And at the same time, my body reacts and my brain recognizes what this is, leading to, from the brain recognition, emotion. So they're saying that it happens at the same time, that the mind and the body are working together to create an emotion. Okay. And then the last major theory is the cognitive theory. All right. And what this one says is that it's a situation, the situation and physiological changes are going to give people clues on how to interpret the correct emotion to feel. But the brain has to interpret those clues and then it has to label the emotion, that it's not an automatic, that it has to go like the stimulus is the dog barking, coming at me, I'm thinking it's going to bite me. Then I'm checking for environmental clues around me. So I'm taking in the scene and my body starts reacting, and I'm using both of those things as clues to tell my brain I'm feeling something, and then my brain has to label what that emotion is. So it's kind of like a step up from both of those theories, right, that they brought into the cognitive theory. Okay. So we see them here. So you can kind of see how we see, this one is the earliest one. So we're seeing that it's going in a direct line. Then we start saying, no. They start doing more tests and they start looking at evidence and they say, no, actually, we think these things are happening simultaneously, mind and body working together. And then they're saying, no, it's not even just that. It's mind, okay? It's body and it's environmental clues. So it's really, we're taking information in with how we're feeling and the environment around us that lead us to think something. And then once we've thought it, we label it as an emotion. So our mind has to tell our body that this is an emotion rather than emotion just happening. So what happens? Oh, let's go back. Okay. So let's think about this for just a second. What would happen if, for instance, somebody had a situation where they could not label or correctly identify an emotion?
Would they think they're feeling it more than they actually are?
Yeah, so maybe they could be feeling an emotion but actually be expressing another one. Can anybody think of an example from this year's movies where somebody expresses an emotion differently than what they're feeling? Think about this year's movies. Where somebody laughs inappropriately or smiles inappropriately.
Joker?
Yes, there you go. So there are actual psychological disorders where your brain is trying to process and label what the emotion is, but the way that you're expressing it is opposite or different from what the actual emotion is. So there are those psychological disorders. Okay, so let's talk about how we express it. All right, so we kind of know this. I mean, this is pretty straightforward, that a lot of how we express ourselves, tone of voice is huge. If I said to you guys, hey guys, make sure that you get in your assignments on time. That's one thing. But I said, you guys, make sure you get your assignments in on time. We use tone of voice as animals. We use that so that others understand the emotion behind what we're saying. Okay? But as a species, we can use tone of voice, right? We can use the words that we're saying and the quality of our voice to change that to express emotion. Facial expressions, however, are going to be something that we're going to see not just in humans, but it's an essential part of how animals communicate emotions. So it's,
What about body language?
oh, we're getting there in just a second. Okay, so can you guys think of a way that animals besides humans use facial expressions to express emotions?
Dogs when they're like smiling or like panting.
Yeah, absolutely. Can we think of another emotion that a dog will show using facial expressions?
Snarling.
Yes, anger. Yeah. Now let's start thinking about are there other animals that will snarl or show their teeth as a way to show anger?
Any animal in general?
Any what?
Any animal in general?
Yeah, a lot of mammals, right? So not necessarily like whales or things like that, but if you even think about sea lions, wolves, tigers, lions, monkeys, right? They don't necessarily have language and tone of voice to express themselves, but what they do have is they have these facial expressions that they can use to express certain emotions. So what they started, and especially Darwin, Charles Darwin, started looking at how animals across the board have these universal facial features that they would use to show displeasure or anger would be by showing their teeth, right? By raising up their lips and showing you exactly what weapons they have to work with. So the part of what Darwin was saying is that humans kind of evolved out of having to do that because of why? Why did humans stop showing their teeth, for instance, as a way to express anger?
Speech and language.
Yeah, right. We had a language. We also developed what?
We made like our own weapons.
Yeah, we made our own weapons. So I no longer had to snarl my teeth. I could express to you in words and with my tone, hey, back off, buddy, right? And then beyond that, we also developed weapons that we could show as something to help. It's almost like a tool of emotion. I'm going to show you this. And in me showing you my weapon, you're interpreting it as anger. Okay. Or fear, right? I might be afraid of you and showing you my weapon to tell you to back off. So there's definitely other indicators that we use to show emotion. Body language is a huge one. Posture, movement, personal space, and explicit actions. So we'll talk about explicit actions in just a second. What I want us to look at are the 4 bullet points above that. Do we, and can you think of examples of when we use body language, posture, movement, personal space to express emotions? Can somebody give an example of one of those?
When with your dad.
Okay. What does that look like? What does your body language look like, or posture, or personal space?
You will like kind of slump when you're walking. Your posture will be worse than normal.
Sorry, my dog was barking. Yeah. Yeah. What else? What other emotions do we show through body language, posture, movement, personal space?
Well, like personal space, if you're sad, like maybe going up to your room or like not wanting to interact with other people.
Good. So like isolation. Good. So we create more personal space to show that we are not comfortable with you coming into our space right now. What else? Can these indicators change from person to person?
Yeah.
Yes.
Yeah. So these are going to be more of your nurture or your environmental factors or indicators, right? So different people are going to express themselves in different ways with body language, posture, movement, personal space, right? And it's going to change from culture to culture, society to society. So for instance, in Spanish-speaking countries, right, to express joy of friendship, to feel welcome, or to feel, who said the word? Hold on. Accepted. Body language is much closer than it is here in the United States. So when people are talking to each other, they're much closer. They often have a lot of physical touch between them to show joy or happiness or feeling accepted, right? There's going to be differences between how men and women use these indicators of how to express emotion. And then there's also going to be those cultural factors too. Now, does anyone think they might know what an explicit action is?
Slapping a person out of anger.
Yes, there you go. So explicit actions would be actions that you do to express anger. So like exactly like that, like slapping somebody to show that you're angry, but even more so, even with like inanimate objects. If you said something to me and I turn around and I walk out and I slam the door behind me, that explicit action is expressing what emotion?
Anger.
Yep, absolutely, right? So we can use actions to help us express certain things. Now, what happens if somebody is unable to read these cues very well? So if I slam the door because I'm angry and then somebody comes after me and is like, hi, and runs up and gives me a hug, they might not find me to be all that welcoming to those things. What happens if someone is really unable to read those cues? Do we see examples of people being able to not read cues well?
Like they'll invade on someone's personal space, or like the person who is expressing their emotion won't feel like they're accepted or understood.
Yeah, absolutely. Can we think of anything? It's not a disorder per se, but it is in the DSM the DSM is going to be the manual. Go ahead.
Sociopath.
Yes, sometimes a sociopaths or psychopaths are unable to read cues because they don't necessarily feel the same things that other humans feel. Does anyone know another category where we're going to look at where people are treated for this?
This might not be right, but autism?
That's exactly it, autism. So many people who have been diagnosed within the spectrum of autism have a hard time reading cues, and so have to either be in therapy to help practice those types of learning what smiles mean versus frowns, learning what body, personal space means to people, or learning what body posture looks like for different types of emotions, or even tone of voice. They have to actually go in and practice because it's not something that they are in tune with or able to read the same as other people. So a lot of times, before autism was really diagnosed, and remember that autism, and we're going to look at it, you'll see it when we do the psychological disorders, it's a huge spectrum. The range of what autism means is so huge, from biological sex, it's different from men to women, and then it's also a range of things. And when before it was really first looked at as something that people have, people tended to push these types of people out of society because what did they see these people as?
Not smart.
Yep, sometimes not smart. Like, I just said that. Can't they tell I'm angry? Like, what are you, dumb? Right? What else? If I can't read cues, how else might these people be interpreted within society?
It's like antisocial.
Yeah, absolutely. Antisocial. So a lot of times, they were kind of shunned by society for a long time because, and even still, like, autism is such a huge thing and people don't really understand what are the difficulties that they face. And part of that is being able to express emotion and read emotion. And so, sometimes they just really don't have the ability to do it. And instead of ostracizing them or shunning them in society, it's a matter of understanding that there are people who have those issues. So, we just want to keep in mind that if you're running into somebody who might be having difficulty, that it might not be their choice, right? They might not physically be able to read those cues the same way other people can. Okay. So I kept it nice and sweet and short for today because I wanted you guys to have monkey time. But I also just want to kind of wrap up our conversation on emotions. I think I don't know what I've got coming up next. I think we're about to get into psychological disorders, if I can remember correctly. which is going to be a really fun last little segment to do. And I did get word today that they should have kind of all their policies and everything set by the end of this week. So that's what they're looking at because they need to kind of wrap things up for seniors. And seniors, are you getting all the announcements that you need to be getting?
Yes.
Yeah.
Are you gonna be there on Thursday?
I can't.
Yeah.
No, I'm high risk, so I can't. I can't leave my house really.
No.
I know. So I'll send you guys virtual messages.
Well, miss.
I know. I was so bummed, but my husband and I talked about it, and we just think it's probably not a smart idea.
How is it like living like in like high risk? Like, is it much different than like how we view it?
It's just really like I've only been out of my neighborhood once since this all started, and that was to go to a doctor's appointment. So it's really just making sure that I stay home. And then my husband's going out to get all the food. And then when he brings it back, we just have to disinfect everything. And then before we bring it into the house, and then we have to disinfect, like wash our hands and wash the countertops and do all that stuff. So, I mean, I'm not going to complain. I mean, there are plenty of people in this world that have it way tougher than I do. But I just haven't been out in the world. So when I went out to go to my doctor's appointment, it was very, very weird feeling to be out of my neighborhood and driving. It was funky. Is anybody? Go ahead. I didn't hear you.
You're like my mom.
Oh yeah, same thing.
She doesn't want to get out of the house.
Yeah. I go out. I definitely go out. It's really important for mental health. Like you have to be outside, get some sunshine, drink lots of water. So I'm going to spell it out because my dogs are listening, but I go for WALKs, daily. And I make sure that I get out in my neighborhood because that's so, so important. Make sure you guys are doing that too. And don't stare at a screen all day. You have to take breaks. Your eyes need it and your body needs it, because if you notice, like when you're on a computer, a lot of times people get hunched over. It's really important that you stand up, stretch, do all those things too.
For the first couple of weeks, we went on days with our dogs, but now we just stopped.
Yeah, you got to get out. You got to make sure that you're taking care of yourselves. Alina, what were you saying?
I said you said that they were going to figure out all the final details about us seniors.
No, I think seniors, you guys have been informed as far as because you got did you get info on virtual graduation?
All we got was that we're having a virtual graduation, but there's nothing
That's a district thing, so I would just wait. I think that was the first announcement, just to let you guys know it was going to be virtual. And so I would just make sure that you are signed up for all, the different news coming out as far as from your class officers. I know they've got something on Instagram, like class of 2020, where they're putting information. And then also I think the district put out that email just saying it's going to be virtual. So I think they'll put out another one, obviously giving you more direction on that.
I mean, they did say that we were having a virtual one, but they said that, I forget his name, but the big honcho, he said he was very much emphasizing the fact that a virtual graduation is just an addition, that they're not taking away our actual ceremony, that they're either going to look into dates for late July or in December, depending on what's going on.
That's what I heard too. So I think that they're